Hi, so Mark again, Fitness for Life. Now I'm going to show you the quad exercise that I did because now what everybody is given and what everybody tries to do is, and all well-meaning, but they typically want you to lay down and try straight leg raises and taking your leg out to the side and in and out and all kinds of things like that. I found, and again, speaking only for myself, I could not do those because if I sat down or laid down and tried to raise my leg, it felt like, number one, somebody's putting a 100-pound weight in my knee. It increased my pain up to an 8 or a 9. Plus, because of the swelling, I could not physically contract that quad because the swelling inhibits that anyway. So there was no way I could even do those exercises. But when I went weight bearing and did them, I was able to do them all. Why? Because it wasn't trying to isolate anything. I was not going into pain, and I was training the muscles how they function. So that's what makes all the difference. And this is what I've studied now for some years. It's applied functional science, and that you can see what I'm learning from Gray Institute. This is where I've gotten these ideas. So this isn't something I've dreamed up on my own. There's a lot of research behind all of this. So that is the principles that I use. But again, because I did this, listen to your doctor or your PT. Okay. But here's how I started turning this quad on, and it's worked really well. What you want to do is the last exercise I showed you, I really loaded the glutes because that's your big power source. And I loaded them by weighting them back and bending more at the hip. What you want to do, so you can put that, you could say what you're doing is you're calling in a lot of friends to help that thigh and help that knee work. Okay. Now what you want to do when you want to start focusing a little bit more on strength into here, now you want to start taking the friends away. Meaning, I want to start tweaking out the glutes assistance. And here's how I did that, okay? Standing on the right leg. Now, this was farther down the road. Let me clarify that. This was at 5 weeks, not initially on this one, because that would have been way too much on this starting off. So at approximately 5 weeks is when I started doing this. And what I did, I would toe tap. Now, again, even though I wasn't on a walker, I would still use a walker or a counter initially just to start allowing those tissues to get comfortable with this. But what I would do, I would toe tap the left. So 80, 90% of the weight's on my right. I was stabilized. But now to tweak the butt out, I stayed upright. And so instead of allowing that hip to flex or bend forward, it stayed upright. Now, you can test it on yourself. Do that. You won't squat as low. You can put your hand on your own butt and you can feel that stays soft. So little mini squats up and down here. That tweaked the main butt out, the one in back. Then for the side, what I did was side bend to the right, because in that drives your pelvis to the opposite side, which decreases the assistance on the glutes on the side and in the back. And then I would do these little mini squats. And again, first of all, using the walker or the counter just to unload that and just going where I could go. Okay. And then the third position, because as what you're noticing, everything is in 3D. All the 3 planes that we function are rotated away. That turned off or turned down the glutes also, and did the little mini squats. And then these I progressed to no walker, to going deeper with these, to now weighting them. Okay. But you try that on yourself, you're going to find that really fatigues this. You can feel it working. Okay. Now, then the big enchilada with that one was I combined all 3 motions. I stood up, so I bent towards that right side because that's the surgical side, and turned away. So now I took the rear out in all three planes of motion and drove those. Then I started hands overhead and here, and then side bent, and then rotated away. So doing those individually and then combining all of them and doing it. And you'll turn on everything here, but you'll really feel how the quad reacts. Now, another way to build up to that, which I did not do, but which I would have somebody else do, would be this is fully tweaked in, okay? With you turn this way here and here, totally got the glutes turned in. I start backing that off a little bit and slowly working my way up, slowly going into side bending and turning away, not to the end range. And then you just keep working that till you finally get up to where you saw where I end. So that's what I'm still doing, because that has really brought back my quad, and I have yet to do a straight leg raise. And again, not knocking what everybody else does, but this is what worked for me. And I think if you try that, you're going to find out. And just as a little test for yourself, if you want to see what I'm talking about, just do a regular squat, okay? And just do how you would normally squat. Then see how low you can go with that, okay? Now, bend over here like this and squat and see how much lower you can go. That's because you loaded all this. Now do it and stand up here and try it and see where you can go. Because now you've taken all that out, and so you'll feel the difference yourself. That's as far as you can go. Not because of my knee, but because none of the other muscles are helping. So that's all I did on that single leg. So this worked for me. Again, one more caution. I did this on myself. I didn't have to worry about if I hurt myself or that, but I also used it as a learning tool to hopefully and be a better PT to other patients, because now I understand more their pain levels and what they can and can't do. Listen to your PT or your doctor first, okay? And remember, everybody's different, so one person's outcome doesn't mean that's going to be yours. If you have further questions, contact fitness4lifept.com.